Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, President Rodrigo Duterte defends the Health Department after the Commission on Audit flags deficiencies in handling billions of COVID-19 funds. More hospitals now in full capacity due to COVID-19 cases. What is the government doing to prevent the collapse of the healthcare system? And as cases continue to rise amid the Delta variant, some healthcare workers are considering resignation over low salaries and delayed benefits. Health Undersecretary and Treatment Czar Leopoldo Vega joins us live. President Rodrigo Duterte slams the Commission on Audit for flagging deficiencies in the Health Department's handling of 67 billion pesos worth of COVID-19 funds. In a speech on Monday, the chief executive says that the COVID-19 budget was not stolen. He also vouches for Health Secretary Francisco Duque and Undersecretary Leopoldo Vega's integrity. Here's the president in his own words.
Stop that flagging. You make a report, do not flag, do not publish it because it will condemn the agency or the person that you are flagging. The flagging is spelled F-L-A-G-G-E-D. Ang ginagawa ninyo is F-L-O-G-G-I-N-G. Flagging. Hampas. Huwag naman sige kayo flag ng flag. Tapos wala namang napreso, wala naman lahat. And yet you know that when you flag, there is already a taint of corruption by perception.
As more hospitals are overwhelmed due to the increasing COVID-19 cases, a group of healthcare workers will be staging a mass protest or work stoppage in several hospitals over the DOH's supposed failure to give just and timely COVID-19 benefits. The country has been recording over 14,000 COVID-19 cases in the past 3 days. Let's go straight to the source of the story. We have Health Undersecretary and Treatment Czar Leopoldo Vega. Yusek, welcome to the source. Maraming salamat po sa inyong oras.
Thank you, Pinky, and good morning to all the listeners out there.
I want to first start with what the president said doon sa COA. Stop flagging. Do you think it's right that the COA flagged this 67 billion pesos in deficiencies in the DOH's budget?
Yes, the Commission of Audit really comes out on the yearly report in terms of their AOMs of the different government agencies. And this is really a part of improving the efficiency and, of course, the diligence in the spending of the funds within every other agencies. These are actually guideposts to help us more improve our processes. But this is not a final report. In other words, we still have time to rectify it because this is an AOM. And if this is just a submission of documents or compliance, then we can actually easily rectify it. But what is most important is that the deficiencies noted is not really a deficit or there was a loss in funds. It's really a matter of compliance, matter of putting up the necessary and required documents and procedural, very procedural. Thank you. And I hope we also would like to inform the public that the DOH is really upfront in terms of spending this COVID-19 funds specifically for our pandemic.
So you don't blame the COA for flagging this 67 billion pesos in deficiency, sir?
Yeah, it's really a part of the territory. I mean, that's how it is ever since. I think it's always been the measure of COA in terms of how best to address the different agencies in improving their processes. So what I'm saying is that the these AOMs, which are actually not final. They're not the final report of COA, so we still have time to rectify. And definitely, this will actually be for the improvement and efficiency of our services.
Right. That is the mandate of the COA, to look into every agency's spending of the budget that is given to them. So,
Right.
but when we talk about 67 billion pesos, USEC, it called it deficiency. COA also said, we are not saying this is tantamount to corruption, or COA saying this is not corruption. But when the public hears 67 billion pesos in deficiencies, which actually means that certain pertinent laws were not, it's non-compliance rather of pertinent laws. Is it as simple as the DOH not being able to submit the documents in time? Yun ho ba ang ibig sabihin nun para po sa inyo?
Right, because in this pandemic, everything has to move very fast in terms of making sure that the necessary funding is out in the operating units, and also definitely in trying to improve the conditions of the different hospitals, regional offices, and the patients themselves. So it's just really a matter of putting in the supporting documents for all the procedures that were done. And I think from the COVID-19 fund audit by the Commission of Audit, there were 13 deficiencies noted, and 5 of these are already complied with, 5 were partially complied, and the rest are 3 are in various degrees of compliance. So it's just a matter of time. We're given 60 days, and we will be able to present the necessary documents needed to support whatever COA findings there are.
Okay. But when you talk about 67 billion pesos, isn't it also incumbent from the DOH, incumbent of the DOH, to be able to have supplied these documents in time? I guess that would be the operative words, in time, so that the COA need not say there were deficiencies. So I guess what I want to find out, Yusek, is nagkaroon ho din ba, would you submit, nagkaroon din ho ng kakulangan or lack of urgency from certain departments of the DOH to be able to submit the proper documents so that hindi po lumabas itong tinatawag na deficiency?
Okay, ang COA report kasi, Pinky, it really ends December 31 of 2020. In other words, from that time on to this current date, even in June, since most of the funds really are continuing appropriations of the year, then we were able to make use of the unutilized funds in 2020. So in other words, we cannot submit a report on December 31, 2020, because we know that the program has still to continue to 2021. It's so hard for us to provide the necessary documents, not unless the program or project has ended. Then that would be it, in terms of the COA audit. So everything here really means that the compliance and the supporting documents ending December 31, 2020 will have to be complied with as the programs continued being implemented.
Okay, so I do understand also that the DOH was saying that they were given time to submit the necessary documents, and they're not going to wait until September, third week of September, or second week of September before they submit the documents. I just want to get your statement on your reaction, sir. What do you want to tell the public, to those who, sabi ko kasi ni Yusek Maria Rosario Vergel, hold judgment until all the documents and evidence have been submitted. But what do you want to say to the public, Yusek, sa mga sinasabing 67 billion pesos in deficiency, yet we are seeing so many problems in the healthcare system and problems coming from the healthcare workers?
Yes, right. The 67 billion that was noted and flagged by COA really means that these are all deficiencies and relates to compliance issues, procedural, and of course, supporting documents. Nothing has been lost. The 67 billion can be well accounted for, And there is no, COA also noted that there were no funds lost and no funds lost to corruption.
The president also rejected any talk of possible resignation of Health Secretary Francisco Duque. Would you say that in the DOH, sir, that Secretary Duque still has some sort of solid support?
Yes, Secretary Duque has a solid support and basically is a man of integrity. And the president has the president really relies on him and trusts him.
Pag-usapan po natin what has been coming out. The problem of healthcare workers, Undersecretary. There is this plan to stage a protest, and even resignation. Why? They are saying that they're not receiving the benefits, sir. They're not receiving their special risk allowance, their transportation meals, even what is due them kung sila po ay nagkasakit o kaya namatayan dahil sa COVID. I know that government said na nabigyan na po yung mga healthcare workers, but there is a disconnect, obviously, because they're saying, some of them are saying, we haven't received a single centavo. How can this actually be explained?
In terms of the benefits, I'd like to put it in perspective that we have, especially for the SRA, we have sub-allotted the funds to the different hospitals, specialty hospitals, the UP system, and of course BARM and the regional offices to make sure that the LGU hospitals and private hospitals will have their due in terms of the SRA. The special risk allowance basically is computed as 5,000 per month, the maximum, and this is going to be divided over 22 days and the number of times he has been working directly with COVID patients. Now that's the sub-allotment of this goes to the hospitals and to the regional offices for the private sector because they receive the master listing of all of the healthcare workers in the private hospitals as assessed and validated by their HR and their hospital administration. And this we take that this is the master listed healthcare workers in the different institutions to be given the necessary SRA. Now, for the SRA of this June to January to June, we were able to give SRA to 359,501, to be exact, 359,501 healthcare workers. And this was downloaded to them in the amount of about 8 billion. So the SRA of the private institutions that we provided also through the regional offices, the private institutions also different hospitals, they were also given SRA to 54,000 plus 128 of healthcare workers in private institution. I'm not offering any excuses, but I would just like to have just get an understanding that it's very hard for us to validate on the central office or certify healthcare workers working directly in contact with COVID. I think the main issue here is that there has to be a proper coordination between the regional offices and the private institutions in terms of validating and making sure that the healthcare workers involved in those hospitals directly handling COVID must be given their due. So we're working on this and we're trying to improve the system because this is the first time we're doing it across several hospitals, not just the LGUs, but private hospitals and even the government-owned hospitals together with specialty hospitals.
Please hold that thought, Undersecretary Vega. We just need to take a very short break. The source will be right back. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, Health Undersecretary and Treatment Czar, Leopoldo Vega. Undersecretary, I want to go back to what you said. From January to June, more or less 350,000 healthcare workers received their special risk allowance, which is about 5,000 pesos for 22 days of work. I guess what needs to be found out here is the numbers need to be reconciled. From January to December, ilan ho ba talaga yung healthcare workers na dapat nakatanggap ng kanilang special risk allowance? Would you have that number? I know you're saying, sir, no, this is the central office and it's really up to, which really makes sense, the regional offices and the hospitals. Kasi hindi naman po central ay bababa ka agad sa mga ospital. Understandable. But has there been a number given to the central office by the regional offices on how many healthcare workers were really eligible for special risk allowance?
Yeah, there is a number, Pinky, because that's where we base our budget really. And this master listing coming from the different institutions, private or local government, or even the government hospitals, will have to be processed through our HR, and we will seek out the budget for this. So in other words, we have a listing of all of these healthcare workers certified by, say, the government retained hospitals, certified by the regional offices for the local government units, and definitely of the private hospitals. So we do have that number in all the hospitals across the country.
So it seems that the 350,000, you say USEC na nabigyan from January to June, are the eligible ones as provided for by the hospitals, whether government, whether private or public, to the regional offices, and given obviously to the central for budgeting.
Yes, right. These are basically in according to the guidelines of the DBM, wherein the SRA should be given to those healthcare workers who are directly in contact with COVID. So that's the basic guidelines as stated.
So what message would you like to give to these healthcare workers, sir? And I'm sure you've heard this, watched this, and read this, na sinasabing hanggang ngayon hindi pa rin po sila nakakatanggap ng kanilang mga special risk allowance and other benefits, and that they are already very, very frustrated, sir.
I know there are many lapses, and just like to say again, I offer no excuses, but an understanding of the whole situation. There are inadvertently miscalculations in terms of the SRA that should be given to the healthcare workers. I think we have asked the different institutions through the regional offices to make sure that the HR of the different institutions will give them at least a number of healthcare workers that hasn't been provided, and we will try to collate this and seek again another budget, special budget for the SRA of the different healthcare workers who were not given their due. So we're trying to arrange this kind of process through the regions of collating different names and of course validation from the hospitals so that we can actually look for a budget for this.
There was an online forum yesterday, Monday, Undersecretary, and the Alliance of Healthcare Workers President, Robert Mendoza, was saying that there will be a protest, some sort of work stoppage that will be led by employees of the 10 biggest hospitals in Metro Manila and even other public hospitals all over the country due to the deprivation of their timely COVID-19 benefits. Undersecretary, what happens to us if this happens?
Yeah, I think this is very unfortunate, and I guess we all understand that we are all in this pandemic, and we have to work as one. And we will work and talk to the different heads of these organizations to make sure that they will be able to get on a timely manner the benefits due to them. And there are many things that are sometimes not of our control. And really one of this is the time element in terms of the sub-allotment of DBM to the central office, wherein we were only given less than a week to make sure that we will be able to sub-allot this to the different units. And since the Bayanihan 2 would lapse on June 30 of 2021. So we are appealing that we would like as much as to help also the different healthcare workers, and we will continuously talk to them and make sure that the benefits are there, because on our end, we are really trying our best in trying to implement as efficiently as possible the Bayanihan 1 and 2 as specified.
To be clear about this, Yusek, are you appealing to them not to push through with this protest or even work stoppage or mass resignation?
Yeah, I think if we would like to appeal to them to please consider the nation as a whole. We should think of nation building at this time. We're trying our best to make sure that the benefits are there. Government is trying to make it as efficient as possible, and as the Department of Health, we would like to implement this also in terms of putting in the resources that is needed for the healthcare workers.
And we need to talk about the daily infections, 14,000 new infections the past couple of days. We want to find out how the One Hospital Command is doing, but we need to take a very short break. The Source will be right back. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, Health Undersecretary and Treatment Czar, Leopoldo Vega. Yusek, I mentioned a while ago before we went on a break, 14,000 new infections, 14,000 new infections the past 3 days. Is the One Hospital Command, my question is this, able to efficiently take calls and refer the patients to hospitals because of this increasing number of infections daily, we've been seeing daily?
Compared, it's really a deja vu, Pinky, and with the last wave that we have sometime in April, on March and April, we do see the numbers of the One Hospital Command at that time really increasing to almost 400 transactions or calls per day. And we were overwhelmed. And that is one of the reasons that we actually expanded the One Hospital Command. We learned our lessons and made sure that we will be able to coordinate and do referrals as fast and efficiently as we can. Now we have improved in terms of the number of personnel in the One Hospital Command, and not only the call receivers, but also the medical coordinators. And we are also pursuing the virtual consultation or telemedicine. At this point, wherein we see a number of new cases rise in NCR and the different regions within NCR, that's Region 3 and Region 4A, we've noticed really an increase to about last August 13, we had almost 513 transactions or calls per day, and we were able to handle that. We're now averaging almost 450 to 480 calls average after August 13, and we hope that with this trend, we will be able to cope up with the different calls and the transactions needed to make sure that we will be able to coordinate and refer all of these patients to hospitals or isolation facilities.
And vital to this, of course, Undersecretary, is the hospital utilization. I just want to bring this up on the screen. In the whole country, 71% ICU utilization, 59% isolation utilization, 63% ward utilization. What it means is for ICU, let's focus on that, 7 out of 10 beds in the whole country are already occupied. And NCR is not far. The numbers are quite similar. What is the plan? Because if I were to put it that way, sir, and please correct me if I'm wrong, 7 out of 10 ICU hospitals beds are full. Ibig sabihin, 3 na lang po sa bawat ospital ang meron. With the number of increases daily at over 14,000 the past 3 days, what is the plan, sir, especially to increase beds, ICU beds for the severe and the critical?
As you know, Pinky, since last year, we have seen this problem or situation wherein this infrastructure of the health system cannot accommodate the number of intensive care patients that we have to address to. And if you see that since last year, we've been trying to increase the number of ICU beds. In fact, I think January of this year alone, we only had an inventory of about 730 ICU beds, but now we have actually allocated and built more intensive care units, and also the modular hospitals that we built in lung center capable of doing 110 moderate to severe cases. So we were able to expand this to 1,230 ICU beds. We are continuously doing so. We will soon inaugurate again. Aside from the Lung Center 110 modular hospital, we're going to inaugurate soon the modular hospital which they started building last 3 months ago in a National Mental Hospital. That's about 220 beds. So this will actually ramp up also the number of allocated critical care beds. And we're also going to finish off with some of the structures in the Quezon Memorial, Quirino Medical Center in the 3rd and the 4th floor, where they can actually address another 40 to 50 intensive care units in that facility. There are also modular hospitals that we're going to inaugurate outside of Metro Manila, and soon we will inaugurate one in Southern Philippines Medical Center in Southern Mindanao and Davao City, because basically it's a high risk. The classification is high risk, and we are building about 44 intensive care units aside from the almost 90 beds of ICU that they have. So we are slowly ramping up through building more infrastructure. Second, allocating more beds from the hospitals and converting part of their wards and even their rooms, single rooms, into intensive care units, so that we can easily accommodate the number of patients that we have.
Health Undersecretary and Treatment Czar Leopoldo Vega, sir, thank you so much for your time and take care.
Maraming salamat, Pinky. Thank you.
Thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.